Antidepressant use is common among reproductive aged women, but what is safe when you are pregnant and taking these medications? Here to talk about safe meds when it comes to feeding for two is Dr. Siobhan Dolan and also Jennifer Lind, a pharmacist. Great to have you ladies on this morning. Good morning.
Thanks for having us. Good morning.
Good morning.
Talk to us about the findings of this new study on antidepressant medication and women of childbearing age. What did you guys find?
So we found in this study that about 1 in 7 women of reproductive age with private insurance filled a prescription for an antidepressant. And so that's pretty common. And so we're here to raise awareness to women to make sure they're discussing the risk and benefits of any medications they're taking, not just antidepressants, with their healthcare providers.
Why is it important that we know how many women of childbearing age are taking an antidepressant?
Well, what's important about this study in particular and knowing the number of women is that it's really common. What this study shows us is that lots of reproductive age women are taking antidepressants. So we really need to spark the conversations between those women and their healthcare providers to think about the risks and benefits of the medications, to think about the risks and benefits of the untreated conditions, because of course untreated depression has health consequences as well. So we want to encourage this great number of women who are facing these issues to talk to their healthcare providers. And again, that could be your OBGYN, your family doctor, your mental health professional. You may have a couple of providers you're working with. So have that conversation and think about the best way to manage your mental health and have a healthy pregnancy outcome.
And after looking at these findings, what really is the message? What do you want to say to women who maybe are pregnant or who want to become pregnant?
Well, the first thing we want to say is don't abruptly stop your medication. So that's one message. A second message is try to get in and talk to your healthcare providers before you become pregnant and plan for pregnancy. And then you have a lot more options in that time frame. So as an example, maybe you've over the years started to take 1, 2, 3 medications to treat your mental health. In anticipation of pregnancy, you may try to pare that down to 1 medication. Perhaps you can get to a single medication that's going to control your symptoms. And then you want to have that be the healthiest option possible as you anticipate pregnancy. Another option could be talk therapy. For some women, maybe trying that in anticipation of pregnancy would be helpful. So preconceptionally addressing this issue and thinking about the implications of the medications and thinking about other treatment options is really a great conversation to have before pregnancy, so you enter pregnancy in the best health possible and then improve your chances of having a healthy pregnancy outcome.
Well, and I love what the March of Dimes and the CDC is doing to kind of work together to really help educate women about this. Explain what you guys are doing to really raise awareness about safe use of medications and pregnancy.
Absolutely. CDC and March of Dimes are partnering with other partners and federal agencies and the public to provide better information through our Treating for Two Safer Medication Use in Pregnancy initiative. And what Treating for Two is really focused on is providing better research and reliable guidance so that women and healthcare providers can have these informed conversations about the best treatment options during pregnancy.
Thank you both so much. Anywhere you can send us online to get more details on this to help raise awareness.
For sure. We have information on both of our websites. So cdc.gov/treatingfor2 has a host of information. And then also marchofdimes.org. We have information there as well in both English and Spanish. So we invite women to come to both of those websites, learn more, educate themselves, and then go back to their doctors and talk about how to personalize those messages for themselves and to optimize their pregnancies.
Thank you both so much. And I'm going to send you to one more website. We're going to have more on this segment posted online, and that's going to be fox4morningblend.com.
And still to come, we are giving you another chance to race your way to the checkered flag. The Daytona 500 is coming up soon, and we have your chance to win tickets. Keep watching to find out how to enter. Also still to come, we are back in the kitchen for a family favorite. We're showing you an oatmeal casserole recipe that is sure to be one of your favorites, too.